Well, nursing is a public trust, and I think one of the strongest values that we have in Canada is around healthcare, access to healthcare, affordable healthcare. It really is a source of pride for Canadians to have a high-quality healthcare system and moving towards the aim of health for all. So nurses have been central to the healthcare system in Canada for 400 years. It's hard to imagine a healthcare system without nurses at the center.
And those values, ensuring that all Canadians, no matter where they live, have access to quality services, are ingrained in how we prepare nurses.
That nurses could be the designers and creators of a new healthcare system in partnership with the other healthcare professions, and that they really are a resource that needs to be tapped into to find out where we should be going for the future, for the hospital sector and for the community sector.
I think worldwide that Canadian nurses are highly respected, and much of that is based on the high standard of nursing education that's provided in Canada. There's a component of a perception that immigration policies are more open, and it is easier as a nurse to, or as a prospective nurse, to come into Canada in the first place. But I think that another aspect is the social justice and advocacy component, the access to a healthcare system that is effective, reliable, and for all people.
So we also often say that physicians diagnose patients, but nurses keep them alive in hospital. And to do that, you need more than just how to do the series of tests and procedures. And of course, the other thing is that nurses work with patients, individuals, patients, families, residents, when they're at their most vulnerable times in life.
So I think the first one is that health and access to health care in Canada are core values for Canadians, and they're things that Canadians feel very strongly about. The other part of it is protection of the most vulnerable among us in our population. And this is very much a core value because it's entrenched in the Canadian Charter of Rights and Freedoms.
Whether it's having a baby, you feel vulnerable often, whether it's your parent who is dying, even if they're 95, the family feels vulnerable. It's definitely the children that are in hospital that are acutely ill and might die. It's you're really working with people in vulnerable times.
I taught diploma-prepared graduates for probably close to 20 years, and I was very proud of those graduates. They did very, very good work, but the system was changing so rapidly around them that we couldn't provide what they needed in the time frame that we had in a diploma program, and we needed the baccalaureateness of an education, the broader thinking, the conflict resolution, the systems thinking, the understanding of healthcare on a much broader scale than we could ever do in the short diploma programs we had.